Hi everyone, I am so excited to be hosting an Instagram Live today in honor of Endometriosis Awareness Month, which is this March. If you give me 1 second, I am going to be joined by an advanced GYN surgeon and board certified OB-GYN, Dr. Erica Stockwell. So I am going to get her hooked up to this Instagram Live so that we can get started. Give me 1 second. Let me see if I can add her. Stay here and we will get started and get all of your word. Okay, I just sent a request. So let's see. Hi, everyone, for joining. Hi, Dr. Stockwell.
Hello. Hi, how are you?
Thanks so much for joining us today.
Yeah, thanks for having me.
Perfect. Okay, let's go ahead and get started. So hi, everyone. If you're joining us from the Advent Health for Women Instagram page, welcome. My name is Ashley Brooke Nicholas, and I am so excited to be joined by Dr. Erica Stockwell today. She is an advanced GYN surgeon and a board-certified OB-GYN, and we are going to be discussing all things endometriosis in honor of March's Endometriosis Awareness Month. I know this is such a common condition, and I am so excited to get some really great information for all of the viewers watching. So thank you so much for taking the time to talk with us today.
Yeah, thanks for having me.
Perfect. So can you get us started and just take a few moments to introduce yourself and tell us what you do?
Of course, yep. So I am, like I said, I'm an advanced gynecologic surgeon and an OB-GYN. I'm based out of Celebration, Florida, and I see I see women and treat women for a variety of different conditions. And one of the main things that I treat is endometriosis. So this is definitely near and dear to my heart. I see a lot of patients with chronic pelvic pain, and endometriosis is definitely one of the foremost conditions that can cause chronic pelvic pain. So excited to be here. Thank you.
Well, thank you so much for joining us. You know, it's so comforting to know that the women of Central Florida have access to an expert like yourself. I know that I personally have friends and family members who have dealt with endometriosis, and it's been sad because even, you know, a few years ago, it was maybe not so easy for them to get the right care. So I'm really excited to talk about this topic. When I talked about it on my Instagram stories, I got a lot of really heartfelt messages from people who either had endometriosis themselves or their friends and family members did. And you could just tell from their concern that they really wanted to get them information that could help. So thank you so much. So to our viewers at home, we're going to go ahead and get started. And I just want to remind everyone that today's discussion is an open forum and it shouldn't replace medical advice. So if you do have a question about your own personal health, please consult your doctor first. But today we are going to be answering as many questions. Well, not me. Dr. Stockwell is going to be answering as many of your questions as we possibly can. Please feel free to leave a comment with a question in the comment section below. And I just want to give you a heads up that sometimes on Instagram Live, the comments can lag a little bit. So if we don't see your question and don't answer it immediately, don't fret. It's only because we don't see it. So if we don't get to your question right away, just feel free to type it again in the Instagram comment section or give us a second just for it to catch up. Sometimes it does lag a little bit. So to get us started off, can we just discuss for a second what exactly is endometriosis and maybe what are some of the common symptoms that people might experience?
Yeah, so endometriosis is where the glandular tissue that's similar to the tissue that should be inside the uterus grows outside of the uterus. So it can attach to the pelvis, it can attach to organs, it can even attach to the diaphragm. And some of the most common symptoms are pain. Like I said, chronic pelvic pain. This is one of the primary causes of chronic pelvic pain. And it can cause other issues as well, like heavy abnormal bleeding, can lead to infertility, can lead to extensive scarring, which can cause a whole myriad of other issues.
So it sounds like there are a lot of very serious symptoms that are going on with this. So I'm really so happy that we're able to talk about this because, like you said, it is common. And those are serious life-altering symptoms and complications. So I'm going to go ahead. We did have some questions that were sent in from our readers. So I want to get those answered first because I know it's, you know, really near and dear to their hearts. So Shannon had asked, and I had a couple people touch on this. Like you said, one of the symptoms is especially difficult periods. Yeah. Are there any tips you might have for the best way to control the symptoms during the period when they might be more intense?
Yeah, so a lot of times with endometriosis, you'll actually start experiencing the symptoms even before the period starts. So a lot of
Okay.
times you'll start to experience pain, maybe days, maybe even a week, maybe even longer before the actual period starts. And so one of the best ways is to control the symptoms is to try to control the inflammation that occurs with endometriosis. And so there's a variety of different ways to try to control this through lifestyle changes. Actually exercising helps to decrease the estrogen levels and
Hmm.
increase your feel-good hormones, and so that can help with some of the pain. An anti-inflammatory type of diet, so staying away from certain things in the diet like a lot of trans fats.
Hmm.
Even taking NSAIDs, so like an ibuprofen, which is what we call a non-steroidal anti-inflammatory drug. These can all help to reduce some of the inflammation even before it starts. And so really, it's the best way to kind of get on top of it with endometriosis. And then we have a whole bunch of other treatment options as well.
That is amazing. And it's good to know that some of those are things you can do right away. You know, you
Yeah.
can implement exercise, maybe a change in diet, taking some ibuprofen or something right away. That is great to know.
Mhm.
So as always, guys, consult your doctor, but those are some great tips to start. We did get a question from Nikki. She says, hello, I have two questions. Is there a correlation between endometriosis and sciatica pain?
There definitely can be, actually. Endometriosis, there's a variety of endometriosis called deep infiltrating endometriosis, which
Mhm.
can affect the nerves. And it can be very, very painful. So if she's experiencing sciatica that seems to be correlated with her cycles, it very well could be a sign of endometriosis.
I'm so glad we're here to talk about this today because I think so many of these symptoms, you know, just when I've spoken to women in my family, some of these symptoms are kind of written off as this just happens, you
Yeah,
know, when you're a woman. And so it's good to know that it doesn't always happen. And if
right.
it is happening, there are ways to treat it and for you to get help. So I hope that helped you, Nikki. And she also had one more question. She wanted to know, does endometriosis affect the immune system?
Yeah, so there's actually a lot of research right now looking at endometriosis and whether it's actually, why some women get endometriosis and why some women don't. We don't actually quite know the answer to that. And one of the theories is, could it be something that's different in the immune system, in the
Mhm.
way that the immune system responds to endometrial tissue in the pelvis? And so I think there's still a lot to be answered about that, but 100%, I think that it could be very much immune related. Yeah.
Well, that's really interesting to know. And I think it's amazing the advances that have already been made in this field. But like you said, I think there is a lot more to come. There's a lot more connections that's going to help even more people.
Definitely.
Leanna also sent in two questions. She said she was really recently diagnosed with endometriosis after having two endometrioma cysts and
Yeah.
had to be put on birth control. And she was wondering, how long does it normally take your body to adjust to the birth control? And is that a type of treatment that you have to be on forever, or is it, you know, until symptoms resolve? She just wasn't sure. Is this something that's for the long haul?
Yeah, and that's a great question. As far as adjustment to birth control, it varies per person. Most people are pretty well adjusted to it after being on it for up to 3 months.
Mhm.
And it is a chronic condition. So endometriosis, unfortunately, at this point, there's no cure for endometriosis, and so it's a chronic condition that does require chronic treatment. Now, that treatment doesn't necessarily have to be birth control pills chronically,
Mhm.
but does require some type of chronic treatment really until women go through menopause. So it's very much estrogen mediated, hormonal responsive, and this is why birth control pills is usually one of the first go-to treatments to help to control the symptoms and the growth of endometriosis.
Okay, perfect. Well, I hope that information helps you, Liana. And then she had another question, and she was wondering, so she is a nurse, so she is
Mhm.
on the front lines, and she was wondering if you had an opinion on getting the COVID vaccine when you had endometriosis. She wasn't sure if that was something that would make a difference,
That's
or not?
a great question. Yeah, no, that's a perfect question. So I definitely recommend getting the COVID vaccine. We have not necessarily seen flares of endometriosis in response to the COVID vaccine, and I got my COVID vaccine, so
That's
I'm
amazing.
definitely a proponent of it. And I think it's the only way that we're going to get past this pandemic is if we have enough people out there getting vaccinated. So I definitely still recommend it, even in the scenario of endometriosis.
Perfect. Well, that is really good to know. We're still learning about everything. And so I know that's
Mhm.
top of mind for everyone. And then another question I wanted to talk on, and I had several people send me messages about this in one way or another, and it really touched me in this topic. I had so many people reach out who didn't have endometriosis themselves, but their
Yeah.
friends or their family members did. And
Mm-hmm.
they could see them suffering with it or not getting the right care or not being able to find the right care. And several people asked this in different ways, but it just really made me think like, okay, this is a very common condition because it is touching so many people and it's touching people who don't even have it. They can see the
Yeah.
effects and see their friends and family members, their loved ones suffering. And they asked in different ways, is there anything a friend can do to support someone who has endometriosis? Or is there a recommendation that you would give them to say to their friends if they need help?
Yeah, no, that's a great question as well. So I think to support endometriosis, a lot of it is increasing awareness. So like what you are doing is amazing with this Instagram Live.
Well, thanks for
And
joining us. Yeah,
yeah,
you too.
so increasing awareness so that people know that, hey, killer cramps are not normal. And women experiencing this, for example, years ago, I have so many patients who years ago they were told by their doctors that, oh, this is just a sign of being a woman. You have to get over it. You have
Mhm.
to learn how to deal with it. I think that not brushing it off and making sure that you are actually realizing that, hey, they're going through something that's not normal and they're in a tremendous amount of pain. And I think also in the workplace as well, these patients, they may need time off of work and they
Mhm.
can't get through their day because they're in that much pain. And I think just doing what you're doing and increasing the awareness and just being there emotionally to support your loved ones through this, that's great. That's the best that we could do. So
I think that is great actionable tips. And, I want to say to all those people who wrote in, first of all, if you're that concerned, I can tell you're already a great friend. You are already a great supportive person. But like Dr. Stockwell said, acknowledging
Mhm.
people's pains, believing them when they say they are hurting, they are suffering, that is so powerful to a friend or family member, just to have someone to listen to you. And I know I'm not a doctor, but as a layperson, I've had people listen to me, and it's truly powerful when people will believe you and listen to you, and be there to support you. And I also want to say two other tips that they can do is you can share this live with your friends. So in the bottom corner, there's a little airplane. You can send this to your friends. They're welcome to join us while we are live, and we're actually going to be posting this afterwards as a permanent resource on my feed. I think Advent Health is going to be sharing it as well, and I will link that in your story so you can actually send this video to them with all of the information that Dr. Stockwell is providing. And I think that's going to be a great resource for people who weren't able to join us today, who may be dealing with endometriosis, or if you know someone who knows someone. Like you said, raising awareness, getting this information out there is so important. And then the
Mhm.
other thing is, if you live in the extended Central Florida area, I would recommend that they go to herhealthnavigator.com. It is a free resource provided by Advent Health. They have a team of nurses that will listen to you for free. They're amazing, and they can connect you or your friends, your family members to the right care for their specific needs. They are amazing. Like I said, it's a free resource. And so if they're just maybe not sure where to start, where to find care, like by great providers like Dr. Stockwell, it's herhealthnavigator.com. I actually have it linked in my bio, and I'll link it in my stories after this as well. So I have a follow-up question on that. Like we talked about this, how common is endometriosis?
Well, it turns out it's a whole lot common than what we used to think, and we're finding it now in about 1 out of 10 reproductive age women.
My goodness,
Yeah.
that is amazing. So that is truly, truly common. So if you're watching this, probably someone you know, is affected by this. And if someone is watching this and they're saying, you know, some of this maybe rings true, but I'm not quite sure how to differentiate between what's normal and what would be classified as endometriosis, how would someone know the difference between normal period symptoms and endometriosis?
Well, it can be normal to have some mild cramping with your period. So not all pain necessarily is endometriosis, but pain that takes you away from your daily life, or pain that starts well before you start actually menstruating or having bleeding, that's not normal. Anything that we call killer cramps, that's not normal. So
That does
if you
not
have
sound
that,
fun.
definitely talk to your OB-GYN about it.
So I would say probably a lot of people, if you're thinking, I'm in a lot of pain, I'm not sure if this is normal, it may not be normal. So if you are in pain, go ahead and consult with your physician and they can help you differentiate exactly what you're experiencing.
Exactly.
Now, I know we touched on this briefly at the beginning, but what are some of the other symptoms that people might want to be looking out for, just to see if they may have this condition?
Yeah, so heavy bleeding along with pain, bleeding more than a pad an hour or a tampon an hour for more than 2 hours in a row is definitely way too heavy. Fertility issues, so endometriosis is one of the leading causes of infertility. Painful intercourse, painful defecation or having painful bowel movements, painful urination, chronic pelvic pain that doesn't seem to necessarily even be related to when you're on your cycle, but could be related to different activities. These are all signs of endometriosis.
You know, I'm so happy we're having this discussion for so many reasons, but like I said, I've heard those symptoms from people, from so many women of all different ages. And like you said, a lot of times it has been brushed aside in the past as this is just part of being a woman. You know, this is just something that you have to deal with. But like Dr. Stockwell said, if you have any of these symptoms and they're affecting your life, if they're affecting your ability to work or go about with your day, go ahead and seek some treatment and see if you can get help for this. So when, I guess if people are noticing, okay, I have some of those symptoms, when is the moment that they should reach out to their OB-GYN?
I would say reach out as soon as possible. If this resounds with you, if this sounds true to you, and you feel like, you know, my symptoms are a little bit worse than maybe my friend's symptoms, then talk to your OB-GYN as soon as possible. There are treatment options that we can get you on right away before the endometriosis progresses. You know, in the past, unfortunately, we've kind of seen this big delay from start of symptoms to when patients are actually diagnosed. There's like average of 7-year delay.
Oh my gosh.
Yeah.
Oh my goodness.
So speak up and come seek help from a physician who is well versed in endometriosis.
So you heard that, guys. If you are thinking about this, if this is on your mind, this is your sign to schedule an appointment with your OB-GYN, have a discussion, because there's no sense in suffering or being in pain if you don't need to, because there are early interventions, like Dr. Stockwell says. So I have another question. Are there any factors that might increase a woman's risk of endometriosis?
Well, while we don't know a specific gene, we do know that there must be some genetic influence because we do see it run in families, unfortunately. Other than that, there's no specific thing that you're going to, you know, eat or do that's going to cause endometriosis. You know, it's other than the genetic component, which we can't change. There are things that you can change in your lifestyle to help treat the endometriosis or keep it at bay once you have it. But there's nothing that you're going to do to yourself that's going to cause it. So.
Okay. Well, that's really good to know. At what age are women typically diagnosed with endometriosis? Is it age related? Is it across a wide age span?
It affects reproductive age women, so women who are getting their periods, and typically women are symptomatic even from their very first period or within the first couple years of getting their period. However, like I said, there's this delay in diagnosis, and a lot of it was because there wasn't as much known about it. It wasn't really as, you know, kind of on the forefront, I guess, of what's out there for medicine. So on average between 25, 35 years old are when most women are diagnosed with it. I'm hoping that with all of this press on it and getting the information
Yes.
out about it, that women are going to start to be diagnosed sooner and sooner.
I hope so as well. And like you said, it didn't even occur to me that, within the first few years of starting menstruation, you might be experiencing symptoms. And, if you're a young teen, if you're a young woman, you don't necessarily know what is normal. And, it may be embarrassing, you may be talking to people. So having this information so that, moms can know, that grandparents can know, that just women in general can know. This is amazing. So Nikki had another question. Thanks for your question, Nikki. She wanted to know, are there any non-hormonal treatment options for endometriosis?
Yeah, there are a number of non-hormonal treatment options. There are options that specifically target the signs or the symptoms of endometriosis. So to target the pain or target the bleeding or target the inflammation. So there are definitely a number of non-hormonal treatment options. And then there are the lifestyle modifications that we already talked to. But the best way to really control the growth of the glandular tissue itself is hormonal. So while there are a whole myriad of different treatment options available, the best route really is to try a combination of different treatment options. And there's no one option that's best for everybody. And that's
so there might be I'm so sorry to interrupt you. There might be a different perfect treatment plan for each individual person.
Yes.
Okay, perfect. So go ahead, speak to your doctor. They will be able to give you the plan that is right for you, your situation, your symptoms. And I see a couple new people joining us. I just want to say hello. My name is Ashley Brooke Nicholas. I'm joined with Dr. Erica Stockwell. She is an advanced gynecologic surgeon as well as a board-certified OB-GYN. And we are talking all about endometriosis for Endometriosis Awareness Month. So if you're joining us right now, feel free to leave questions in the comments below. Dr. Stockwell is going to answer as many questions as we have in our time remaining. So I have another question for you. I know that you had talked about endometriosis affecting fertility, which is, such a topic that's so near and dear to so many women's hearts, especially around my age. I know a lot of the women in my life, my friends are trying to conceive, some of them are having issues. How can endometriosis affect fertility? And are there any treatments for endometriosis that could help restore that fertility or increase their fertility if it's been diminished?
Yeah, so endometriosis is one of the leading causes of infertility in young women. And the way that it causes infertility is twofold. It can cause scar tissue that can lead to blockage of the tubes. It also, because of all the inflammation that occurs with endometriosis, it leads to a change in the homeostasis of the pelvis. So even if there's no, scar tissue that's blocking the tubes, that doesn't necessarily mean that it's not going to affect that person's ability to get pregnant. And so yeah, there are definitely treatment options to help to increase fertility. One of the best treatment options actually for helping with fertility when endometriosis is the cause is surgery. So surgical excision of endometriosis has definitely been shown to help increase chance of getting pregnant.
That is amazing to note that there are treatment options available. So if you are having any of the symptoms that Dr. Stockwell has discussed, including infertility, reach out to your OB-GYN. They may suggest some of these treatment options to you, such as surgery. You could get connected to a surgeon like Dr. Stockwell herself, someone who's in your area who's going to be right for your situation. So that is so good to know that there are effective treatment options out there. Now, I have a follow-up question. What happens if someone has endometriosis and it goes untreated? Are there any side effects of leaving it untreated over a period of time?
The endometriosis that goes untreated tends to proliferate, and as it proliferates, it causes scar tissue, more and more scar tissue. And so there's different stages of endometriosis. Stage 1 is mild implants all the way up to stage 4, which means excessive scar tissue. And so it can attach everything in the pelvis. It can attach the uterus to your bladder, to your bowels. It can stick the ovaries down in the pelvis. and it can lead to a tremendous amount of pain, as well as rarely, issues with the bowels like obstruction, issues with the bladder, a lot of pain with the bladder, and sometimes even bleeding when having bowel movements or urination.
It's so sad to know that this condition has been brushed aside in the past, because that sounds so serious
Yeah.
and so painful. And I'm so happy that you're here to spread awareness. So if you, I know I keep saying this, but if you're, hearing Dr. Stockwell talk about these things and saying, I've had those symptoms, please go seek treatment. Like she is saying, there are options for early treatment, and you want to avoid these side effects if you can. So if you're experiencing symptoms, or if you know someone in your life, please encourage them to seek out care, so that we can hopefully prevent women from having some more of those advanced symptoms. And now, I know we've talked on a couple different things in the past, but just kind of to, do it in summary, what are some of the common treatments that are available for the management of endometriosis?
Yeah, and so there are treatment options that really are across the board. So there are lifestyle modifications. There are some alternative treatment options that can help, like acupuncture, pelvic floor physical therapy. There are medical treatment options, both hormonal and non-hormonal. And then there's surgical options. And there's a couple different surgical options as well, with really the mainstay treatment surgically being excisional surgery.
That's amazing. So there are tons of different options that are going to be, maybe right for some people, maybe not right for others. So definitely reach out to your OB-GYN, get assessed based on their recommendation. You can also speak to the Advent Health Women's Health Navigation team. And if Dr. Stockwell or another doctor like herself recommends something like pelvic floor therapy, they're going to be able to connect you to those providers as well, so they can make it a really streamlined and easy experience. Thank you so much for joining us today, Dr. Stockwell. I truly appreciate you being here to answer all of these reader questions and give us some more information for Endometriosis Awareness Month. You are just such a joy to talk to, and I really appreciate your time.
Thank you. It's my pleasure.
Thank you. Mine as well. And for everyone joining us at home, thank you so much for all of your questions. Thanks for tuning in. Like I said, we will be making this a permanent resource on my feed. I believe Advent Health will be sharing it as well. And I will put that link in Instagram stories as soon as it's up, so that you can send this to your friends. You can save it and bookmark it for future reference if either you have endometriosis or someone that you love does, or if you meet someone who experiences these symptoms. And for those of you who are watching who, maybe you resonate with some of these symptoms, or maybe you have other healthcare symptoms and you're just not sure where to get started, I would encourage you to go to herhealthnavigator.com. That's HER healthnavigator.com. It is a free resource from Advent Health for Women. It is amazing. I've talked with Doreen. She's one of the nurses there, and it's a group of nurses that Advent Health provides for free, and they will listen to you. You can describe, what's going on, what kind of care you're looking for, or maybe just your symptoms, and they can recommend the care that you need, and they will connect you with everyone you need to be connected to. It is free of charge and so easy to use. So that link is in my bio. If you want to go ahead and click that, it's herhealthnavigator.com. And I will also include a swipe up in my stories that's easy for you guys to access. And then, as always, I'd encourage you to follow along with Advent Health for Women on Facebook and Instagram. They are such a wealth of information and provide lots of different updates on women's health and management. So thanks again, Dr. Stockwell. I hope you have a great day.
Thank you very much. You too.
Okay. Bye. Bye, everyone.
Bye. Bye.